Hi, my name is Adrian, and Hanya has asked me to talk to you a little bit about my job. I live in California, and I'm a school nurse. In California, all the school districts are run by the individual cities, and I work for Pasadena Unified, which is the city next to Los Angeles. And I work at a very small school. We have about 230, 240 students, all between the grades of kindergarten and 5th grade. That means it's age about 4 to 5 to age 10 or 11. And I'm really unique because I work at a school that serves children with disabilities. So I have about 80 kids on my campus that have special needs. That means they have a disability of some kind or the other, either a learning disability, or they have difficulty learning things, or they actually have a physical handicap like cerebral palsy or epilepsy. Some of my kids don't walk, they use wheelchairs. Some of my kids don't eat normally, they have tubes in their stomachs. So I help those children to be at school, and I help keep them in school and keep them healthy while they're at school. It's a great job. I work the same hours as the teachers do. I have all the vacations that the teachers have, and I really enjoy working with the children. Nursing is also very fun because you get to help people a lot. In order to become a school nurse here in California, you have to have a bachelor's degree in nursing, and then you have to take an exam in order to become a licensed nurse. And that's a national exam that you take, that every nurse has to take here in the United States. And you have to pass that exam in order to get your nursing license. Once you get that license, then you can call yourself a nurse, and then you can start applying for jobs at different areas. When I first started working, I worked in a hospital on a floor that took care of patients who had surgeries. So I took care of people who had their appendix removed, or their gallbladder removed, or who had a hysterectomy, which means their uterus removed, and I took care of them until they were able to go home, after their surgery, until they were able to go home. Let's see, what else can I tell you?
College.
Oh, for a nursing degree, you have to go 4 years of college, so you do basically about 2 years of prep classes, which include English, mathematics, and basic science class, anatomy, physiology, chemistry, biology. You take all of those courses, and then you do 2 years of nursing courses. So you do what I call the bed, baths, and bedpans class, which is a basic class where you learn how to give a patient a bath, you learn how to help assist patients to go to the restroom, and you learn how to change beds. And then you get into the surgical med-surg, which is surgical areas, and you do pediatrics rotations, you do maternal child rotations, which is obstetrics, and you do what they call geriatrics, which is for older patients. And so you study all these areas, and then after you graduate from nursing school, you can choose to specialize. You can either work in a hospital, or you can work like I do as a school nurse. There are also opportunities to work as a home health nurse, where you go to people's home and you take care of people in their homes, or a public health nurse, which you help control diseases out in the community. There are lots of opportunities to work as a nurse, and you can travel. I have a good girlfriend who traveled from state to state studying, working in different hospitals in different cities. So nursing is a great job, and a wonderful opportunity to do many things, many types of different things. So I want to thank Hanya for the opportunity to talk to all of you, and have a nice day. Take care.